Let me ask you a question. When a patient walks in for consultation, how much time are they given by their doctors to explain the reasons of their visit? Let me give you a hint. 11 seconds. 11 seconds. That's on average the time doctors actually listen to their patients when they're trying to explain their reasons for their visit. This is according to a study conducted last year by the University of Florida in the United States. Only 1/3 of physicians actually listen to their patients, actually take the proper time to listen. In that context, let me ask you another question. Before this summit, when was the last time you had the patience to actually sit down with a close friend, a family member, your kid, to explain the risk factors of CVD, but above all, to maintain healthy living? Because at the end of the day, it's about health care, not sick care, right? Change starts with empathy. And empathy starts with the people right by you. And that includes listening to each other. Now, this is a bit of what some of the heart advocates came to share today. They have taken matters into their own hands, reaching underserved communities to explain some of the biggest determinants of CVDs and support, of course, those already struggling with it. At the end of this panel, we will be opening the floor to you, to your questions. So do start taking notes, because this is your very last chance to say what you want to say and ask what you want to ask. For now, please join me in welcoming Agamroop Kaur, 2022 Barry Fisk Youth Advocate of the Year; Jodi Smith, Program Director at Mended Hearts; Lashley, Executive Director at the Lashley Foundation, UNICEF Youth Ambassador, and Miss World Barbados 2018. And finally, Staraite. She is a patient who has experienced heart failure herself. She is the president of the Lithuanian Heart Failure Association, a patient organization, and also the chair of the Heart Failure Patient Council at Global Heart Hub. Now, Agamroop, because you're sitting right by me, let's start with you. Sure. You began your tobacco control advocacy to protect those closest to you. You even created a short documentary to call attention to the youth e-cigarette epidemic. Was there a specific experience that triggered your drive to enter this advocacy world?
Yeah, I wouldn't say there was a specific one changing experience. I would say it was a very much of a buildup of experiences. I was lucky enough to grow up in a household that really cared about health. I mean, none of my parents are doctors, but they really ingrained the value of health in me, starting from early childhood. My mom to this day makes sure I eat fruit every day. So it's been an intrinsic part of my growing up. And when I didn't see that same value reflected in our schools, that's what really started to open my eyes to things, where I noticed in our classrooms there was youth just vaping in those classrooms. Our school bathrooms were being shut down because vaping was such a big problem. And I couldn't go by day losing friends to the problem of vaping and not do anything about it. So I think for me, it was really about answering that question of why is harm so accessible to youth, and why we haven't already done anything about it, and just really making my voice heard to make sure that those around me, and also my sister and my younger siblings, are able to live in a universe that is healthy.
And now, tobacco, including primary smoking, secondhand smoke, and what you just said right now, vaping and chewing tobacco, is the most significant cause of premature death in the world. What is a successful and innovative advocacy strategy to address this CVD risk factors from your experience?
Sure. As a board member for the Campaign for Tobacco-Free Kids, we've done a lot of campaigns and really integrating tobacco with so many other different causes, like climate change, for example, just because the issue of tobacco spans the many dimensions of health and justice. It's not a one-dimensional issue by any means. For my documentary, as you mentioned, that I think was one of the most innovative things that I've done personally, just because it wasn't something that I knew in coming in how to do. It was something I figured out along the way. way. And I made that documentary as a means of understanding what I, as a viewer, would want to see. Putting information out there in a short form, video that's understandable to society as a whole. You don't have to be a professional to understand that video, but it also ends in a call to action. I think that's one of the biggest things we can do, is making something that is sort of inherently educational, but it gives people a motive to continue and make change.
So basically paying more attention to video, social media, that goes a long way as well, especially for the younger generations.
Definitely. I think social media is one of the biggest ways we can get more people involved.
Thank you. Now let's move on to Aiste, as she will need to leave mid-panel because she needs to hurry up and catch a flight. So let's get right into it. Your advocacy journey came directly from the heart.
Yes.
And since then, you've been touching the hearts of many others. And I don't mean this in a figurative way, I mean this in a literal way. For those who listened to our Russia symposium yesterday, you might remember how Aiste went through a heart transplant just 2 years ago. She was misdiagnosed for years before she reached a cardiologist. It was not until she arrived to the emergency room that she was finally diagnosed. So when was the moment really that you decided, okay, I need to help other people like me and join organizations that are actively working to educate others about heart health?
Thank you for the question. Actually, it was since the beginning, since the diagnosis, because I realized that, I was not even 30 years old when I heard the diagnosis, and I was like, okay, I have so many people around me who are my age, and they have no knowledge at all about the heart disease. So my goal was what I can do from my side, especially sharing my story, to impact and empower other people to pay attention to their health and pay attention to their heart. And that's where my advocacy starts. So I started sharing slowly, started sharing my story, and even telling my friends that how I've been diagnosed and this is how it is. And I didn't feel that big impact since until the point when I needed to receive the left ventricle assistance device, the LVAD, the artificial heart. And in the beginning, I thought, maybe my story is not that powerful enough because it's just a heart failure, that people don't really pay attention. But when I received the left ventricle assistance device, it was a major surgery, open heart surgery, and I started sharing my communication through the social channels. This is when I started gaining the attention of everyone, basically. For example, in Lithuania, talking with the cardiologists, talking with the different organizations. As well, when I received the left ventricle assistance device, I was appointed to be a president of current Lithuanian Heart Failure Association, which is focused on the patient and is the patient organization. And I started my work through the advocacy of educating and supporting patients in Lithuania. And along together, my organization in Lithuania is an affiliate of Global Heart Hub, which again is where I'm chairing a heart failure patient council specifically. So the Global Heart Hub is the umbrella organization where we unite the patient organizations in cardiovascular disease and represent the patient voice and manage to improve the better outcomes for the patients as well, working with the patient organizations so they can do then the work on the national level to support the patients, educate, empower, and do all the great work.
So can you share a bit of the best practices from that advocacy journey? What has worked best?
The best practices would be the engagement, and I always say that communication and engagement with different stakeholders is the key here, because working along together very closely, for example, in Lithuania with the Lithuanian Cardiac Society really helped us to build the literature, for example, for the patients, right? When we have the educational sessions, we always have the clinicians speaking as well and presenting what are the new treatments, for example, for the patients, how we can help for the patients, already existing patients, how to live best life with, for example, heart failure, right? And not only focusing on the patients, but on the general society as well. We want to increase the health literacy, right, that we've been talking yesterday and today, and through the activities such as, for for example, testing the risk factors, right? The blood pressure, heart rate, saturation, glucose, cholesterol. That's what we did and we do on a yearly basis through our events during May in the Heart Failure Awareness Month, basically. So the collaboration is the key here, and as a patient organization on our own, as an organization, we cannot do the work. And we cannot be so powerful to deliver what we want to deliver. So collaboration is the key, communication is the key here, and that would be the best practice.
So collaboration and communication between clinicians and patients?
All the stakeholders.
And the stakeholders.
That will be the policymakers, that will be the payers, that will be clinicians, the patient organizations as well. So everybody working together, you know, for better outcomes, for the better goals of the patient, to representing their needs. From the patient perspective, for example, in Lithuania, we do collaborate with the government. If there's any policy change, we sit on the panel in the advisory board. So there is a communication happening there. Of course, I think from my side, I would like to see more engagement there, but I think it's just a matter of time when we will be, you know, reaching that level where we all work together, you know, we're reaching the goal.
Thank you so much. Now, Jodi, with you, your advocacy journey also came very close to your heart, and that was with your third son. Can you tell us a little bit more about why you joined Mended Hearts?
Sure. We had a very healthy family, and so when I was pregnant with my third son, at a routine 20-week ultrasound, we were told that he would be born with a severe congenital heart defect that would be 100% fatal unless he underwent a series of 3 heart surgeries. So if you can imagine finding out that news when you think you're just going on a routine visit, it was devastating. So with that information, the first thing I wanted to know is he going to make it through this? Is he going to survive? And then the second thing I wanted to know is, so how do I live with this? How do I manage it? And I looked around and there were no peer support organizations in my area at the time. And so I felt extremely alone, extremely devastated. And then in 2005, I became aware of Mended Little Hearts. Now, Mended Hearts has been around since 1951. It's the second oldest peer support organization in the United States after Alcoholics Anonymous. So we've had a long history, but Mended Little Hearts program started in 2004 to address specific needs of families of kids with congenital heart disease. And once I found out about that program, I knew I had to be involved, because you can either take a diagnosis, whether it's heart disease, congenital heart disease in your child, and you can decide to feel sorry for yourself and just do nothing with it, or you can take it to help other people. And I just decided that is what I wanted to do. And so I started the 9th Mended Little Hearts group in the nation, and I became staff in 2007.
All right, so what has been the best practice in your view that Mended Hearts has been able to apply in the journey to support patients with heart disease?
Yeah, so there are so many things. We do support, education, and advocacy, and the support is peer support, and each one of those is vitally important. So those are what we call our 3 pillars, and if you imagine a stool with 3 legs, you can't really have one without the other. You need all of those things to help patients to the best of your ability. And I think one of the things is we can have all the medical information we want, but we've heard how little healthcare actually happens in the hospital or the cardiology office. Healthcare happens at home. And so who's helping you then? Who's supporting you then? And so you have a peer support organization like Mended Hearts, and we come along and we say, hey, I've been there. Here are some resources you can use. Here are some information that might be helpful to you. Here are some treatment options that are happening around the nation that maybe you want to be aware of. And it creates empowered patients and empowered parents. And that makes the world of difference. And so I've had a wealth of knowledge since I joined the organization. And I've been able to do a lot of awareness and education in congenital heart disease as well as heart disease.
So talking about empathy, right? That's
Yes.
one of the main things that you've been showing other patients. And that is one of the main things that we need to take in mind when we want to make a meaningful change?
Yes, so we have something called accredited visiting, and I get to train the patients and the parents in accredited visiting. It's one of my very favorite things to do. And these patients go into the hospitals and they talk to patients outside of the hospitals as well and give them peer support. And before COVID, we did over 200,000 of these visits a year. And one of the main things we train in, we have a very unique program. So we have a pretty strict training, and we train in empathy and active listening and diversity sensitivity and privacy and confidentiality, as well as other things that are really important, which make our program very different than just going into a peer support group.
So important. Do you think that's one of the things doctors need to start practicing a little more?
Yes, I think that people don't realize, one, when you get connected, actually, in mental health, peer support has been an evidence-based practice since 2007. Yet in chronic disease, we don't realize how much it can improve community health, it can improve individual health, and you see all of us here as patient advocates, it can improve societal systems and societal health. And so it's really important, I think, for doctors to understand the power of peer support, the power of patient advocacy organizations to help patients and get involved with them.
Thank you so much, Jodi.
Thank you.
Now we keep going with Ashley. Now you're a beauty queen, and you started your advocacy journey at age 16. So what does beauty pageants have to do with cardiology and heart health?
Well, for me, coming from Barbados, when I was 16 years old at school, I realized that most of the foods which was being sold within our cafeteria were often high in sodium or fat. Oftentimes, me and my friends were buying chips and chicken, chips and fish, or very unhealthy foods daily. So one day I realized that there were limited healthy choices for us as young people to really purchase those meals within our schools. So I started this movement in Barbados called the Schools Against Non-Communicable Diseases. And then after doing a little bit more research, I realized that cardiovascular diseases is the #1 cause of death in Barbados, and 1 in 3 children at home are either living with overweight or obesity. And our government also spends $64 million every year as it relates to addressing cardiovascular diseases and other chronic diseases. So I formed this organization or movement that looked at bringing necessary awareness to our children and young people about the importance of practicing healthy lifestyle. And being in the overall beauty queen or pageant realm, it was really important using that platform to bring the necessary awareness to the citizens of Barbados about the importance of practicing healthy lifestyles, the reduction of tobacco use, participating in physical activities, and the limited consumption of alcohol. So through the Schools Against Non-Communicable Diseases in which we formed, we embark on various school tours across the school. We also looked at implementing a program for school students that looked at reducing the body mass index of children who are either overweight or obese. And within that overall realm, I remember growing up too, it was often taught that Barbados is considered the #1 or capital amputee nation in the world. And for my Beautiful Purpose project, going into the Miss World show, I wanted to know if it was a myth or if it was a fact. And even I was studying medicine at the time when I became Miss World Barbados, and using that platform, using that research and volunteering at the rehabilitation department at our local hospital, it really dawned on me that there's so many persons within our country that are suffering or are living with a form of cardiovascular diseases. And there are lots of persons as well that are also living with diabetes, and their limbs have to be amputated as a result. So I just wanted through that movement to bring the necessary awareness to persons about the importance of maintaining a healthy lifestyle.
And then your foundation eventually became very interlinked with climate action. And that's when you founded the HEY campaign, which stands for Healthy and Environmentally Friendly Youth. So tell us a little bit about how that came about.
So it was a bit different because my journey started in health, but then I realized that the health of our people is interconnected to the health of our environment. And even through the same Schools Against Non-Communicable Diseases that I started, we had a motto that went, a nation's greatest wealth is its health. And coming from a small island developing state like Barbados, we're very susceptible to the changes within our overall environment. And I remember reading stories about Hurricane Maria and Hurricane Irma, which devastated the lives of people. And another vulnerable group which was impacted is that of children who were displaced as a result. So through the Hey campaign, which was formed, it was to ensure that the entire process relating to environmental and health action is youth-led. And through Hey, what we do is build the capacity of young people to advocate for health and climate justice, and we implement varying programs. I think another important aspect of the development of that program as well when it comes to supporting youth-led advocacy is that of ensuring that young people are given access to financing their projects and programs in order for their advocacy efforts to continue. So through that Hey campaign, the Hey campaign movement, last year we implemented the Hey Global Climate Fund, where we looked at reimagining and redefining climate finance in an intergenerational context. So we had 3 different categories for young persons to apply for, and it was focused on climate and health, climate entrepreneurship, and climate and gender. And we got a total of over 1,500 applications from young persons globally. And it just shows that when it comes to advocacy and innovation, young persons do have ideas and solutions, and they just need the necessary financial support and capacity building instruments as well to ensure that their advocacy journeys continue, even if it is outside of cardiovascular diseases, health, or the environment.
Yes, and I don't know if you've noticed something in common here, not only that they're all women, but all of these members of the panels have a link to youth advocacy. Right, you with whatever you're approaching right now with social media and videos to approach the younger generations and family members. Of course, your son as well, who was diagnosed even before he was born, and then both of you as well, very interlinked with the hard literacy with the young generation, getting people involved with the young generation. We see this advocacy very effective when it comes to climate action. We have here a statistics here. According to a large survey released in 2021 by Oxford University, 70% of people under 18 believe climate change is a global emergency. And the survey included responses from more than 1.2 million people in over 50 countries. So that shows the interest that the younger generation has in our climate, and we need to use that to involve them as well in cardiovascular health. There is still hope, and that is with the younger generations, definitely. Now, I do want to open the floor to the public. This is your very last chance before we end the summit to ask any questions you have or say any final remarks.
Hello, everyone. As the Advocacy Chair for the World Heart Federation, first of all, I want to say thank you. Thank you for refreshing our minds, our spirits, and really ending with a very high point around your engagement and youth engagement. What I would ask you is how do we better work with the young voices, with your specific causes as the World Heart Federation? So just leave us with some good ideas that I could take back to the committee.
I can start with you.
Sure. I think it starts with the conversations young people are already having and in the places they're having them. One of the things we noticed in California specifically, we talked about the environment. Environment there is also directly related to health. We have a huge wildfire problem, and one of our wildfires actually started because of a discarded cigarette butt. It burned more than 300 acres because of one cigarette butt. And we brought awareness to that because a lot of young people were talking about it. Our schools are shut down every time there's a wildfire because of the smoke. And we had a huge march through California, actually at the Capitol, by by basically bringing youth all over California that wanted to be a part of it and connecting them to their representatives. So I think by actually creating those pipelines where youth are able to talk to their representatives, are able to share their stories, because they all have them. I think we see the diversity in them right here. And just making those pipelines very clear by funding their efforts like we talked about, giving them a voice on social media, on platforms as such. I think all of those are really just relevant ways we can voice youth better.
Yeah, so congenital heart disease is the most common birth defect in the United States, and it's the leading cause of birth defect-related death for babies under 1 year. And most people are unaware of it. We did a survey a few years ago, and 51% of parents had never heard of it before their child was diagnosed. So we realized there had to be awareness, and it has to start with the young people. So we started a campaign called Rock Your Scar. Mended Hearts and Mended Little Hearts and Young Mended Hearts are our 3 programs of the Mended Hearts Inc., and we do a lot of awareness campaigns around different diseases, and this one is for congenital heart disease. But the cool thing about it is we were able to make the kids feel not ashamed of their scars, but empowered by them. And when we think about cancer, we think about the kids with the bald heads, but nothing builds awareness about congenital heart disease. And we, thanks to Amy Verstappen, who's here, we found out about a study out of Australia that said the scar was the leading awareness piece for congenital heart disease. So we started the Rock Your Scar campaign, and it instantly took off. And one young woman, she was 13, Lola, she was from Puerto Rico, and she won the Rock Your Scar contest for her age group. And she said to us afterwards, I had never showed my scar before. I was so ashamed of it. And this empowered me to make a difference. She went on to write a book. She got pulse oximetry screening passed in Puerto Rico, and she was a spokesperson for Mayo Clinic after that. So when you give them something that empowers them, it makes them feel like they're not a victim of disease. And that's the same with Mended Hearts too, but you can embrace your disease and you can rock with it, you know? And that really makes a big difference and resonates with youth. So that was a good question, but I lost the person asking.
Thank you so much. Ashley, what would be your best advice to approach the youth, to work alongside the youth?
Yeah, definitely. And I guess I can also add on from my colleagues. I think empowerment is great, but also when it comes to really involving young people, we must look at implementing a multi-sectorial approach to youth advocacy, and collaboration is extremely important. And oftentimes persons say you must give a voice to the voiceless. But today we're seeing that so many young people, like you said, are rising up and taking their own individual action. And you know, platforms like social media is extremely important in empowering young people to share their voices and share their stories. I often say that the biggest way to communicate with any individual is that each and every one of us present today, we relate to a story. When persons relate and identify to a story, that's where we see the necessary change rather than waiting for something to happen. Once we can use our voices to tell our stories, that's where the biggest empowerment comes from. And I think that that's where the World Heart Federation can continue to ensure that there is a multi-sectorial approach when it comes to addressing the issues that are affecting us as young people. But also, even coming from the environmental field, I recognize that a part of their environmental advocacy efforts, it looks at addressing environmental issues with varying social factors and ensuring that it's interconnected to various social, economic, and health issues. So you also have to make sure too, when you're talking to young persons, that the language is as inclusive and as diverse as possible to make sure young persons outside of these spaces understand what is being said within the overall discussions related to cardiovascular health.
Fantastic. Thank you so much, Ashley. Now, Aiste, in under 30 seconds, what would be?
We have a time constraints now. I mean, Ashley, I think, said it all very well, and I think I will repeat one more time. From my perspective, it's all about the collaboration. So working with the patient organizations, working with the umbrella patient organizations, for example, that are existing already, such as Global Heart Hub, where we have a community of the patients there. And the goal here is to hearing from the patients who are already living with such, for example, experiences and heart disease. So patient testimonials here are very, very important. And I think we can reach that through the collaboration working together.
Thank you. The gentleman over there.
Okay, thank you very much. My name is Ad Adams. Yes, first of all, let me congratulate my colleagues advocate for their efforts they are doing in their various countries. From their delivery, of course, it can be observed that they've had a successful journey in their advocacy work. I wish to ask whether if they've encountered any challenges on their advocacy journey vis-a-vis with policymakers, of course, cardiologists, on their advocacy work. And secondly, it's not a question, but of course, from all what, of course, we've discussed since yesterday, one thing resonates well with me, that of course, from what the minister said, that in terms of financing some of the activities regarding CVD, there's no funding. This is not the first time I've heard that. I think the onus lies on us today that, of course, if we could actually come or build one consensus and say, yes, we are going to push for global fund for CVD hypertension starting from now. Of course, governments, various governments, World Health Organization can actually put their mouth into this, of course, then we work together to establish a fund to support CVD activities, hypertension activities, because it is very unfair that in my country, you see people calling for support for heart surgery, a lot of people dying out of this because there's not money, there's not any available fund to support such activities. So it calls on us today that, of course, if we can form one, speak with one voice and say, yes, we are all calling for an establishment of global fund for CVD, which will go a long way to help us to improve cardiovascular health as we are all calling for. Thank you.
Thank you. What country do you come from?
Ghana.
Ghana. Okay, so before our panel, we were actually discussing about how it's almost impossible in many other countries to go to a cardiologist because it's just so expensive. There isn't the money to support that. We don't have the budget to take care of our hearts. So anything that you would like to add on this?
Sure. One thing that I think sort of we were mentioning challenges as well earlier. Yeah. One of the biggest challenges in the U.S. amongst youth is, and actually amongst the whole population, is we lack serious health literacy. And I think that starts with our education through K through 12 and even earlier and later. And I think one of the biggest reasons for that is that even where we do have access to education, the education isn't actually, like, it's not impactful. Youth don't understand why health is so important to them or why it should be something that they should value. Because our education systems where we do have it is structured on like a memorization of factoids and then regurgitating it on the test. It's not really about, okay, well, you're learning this, but where does it impact you in your body? And so one of the things that I worked on actually taking sort of out of my own funds was bringing hearts to classroom, pig hearts and pig lungs, and using connections that I had with the county department in our school district to basically help with funding that a little bit, but bringing the education right to classrooms and working to change education programs in my own district, because sometimes you do have to take action from your own pocket and really put your own time into it to basically be able to make change, and that's some of the ways that we've done it. But I'd say the challenge really is about health literacy and expanding that and making it impactful across the globe.
And I would just add to what Agamroop is saying, because I think that health is a community issue. So some of the things we can do, providing some health education and information in communities, actually isn't that expensive, and it's preventative care. If we can make people aware, like what you're talking about, make people aware of the health issues in the first place, provide them with education and peer support, let them understand, like to Aiste's case, family history, how genetics and family history fit into this, then you can prevent a lot of the things just by doing activities in the community that better the community, and one community at a time. You don't have to address it like, I know we want to fix it all at once, but we don't have to. We can start with smaller communities.
And that is how, when we make other people care in that way, we make also the media care, and that reverberates as well. So we make the politicians care. So then we start getting into the policies, into the money, et cetera, et cetera. So that's a good point. Aiste, I know you need to leave soon, so I'll give the word to you.
Yeah, so we all know that, the funding is the difficult part, especially in the small countries such as Lithuania. But we have a chance, and we what we did in Lithuania specifically for the patients and touching on the mental health, for example, you know, there we are so underrepresented with the great specialists working particularly in CVD from the mental aspect, and we know how mental health is impacted for the patients who hear the diagnosis, let's say, of heart failure. So what we did with the Lithuanian Heart Failure Association, we collaborated with Lithuanian Psychiatry Association to provide the free sessions to all the patients who need to consult in terms of the emotional support and mental support. And I think that's one of the ways as well to kind of, you know, when you're very, like, with a limited budget, you have to find the ways of how to improve the care and how to support the patients in all ways possible, especially knowing that, you know, all our work, for example, within the country on the national level is voluntarily. So we are very limited of the activities that we want to really deliver and how we want to support patients in a full way.
Ashley?
Well, for me, the reality is that cardiovascular diseases are wreaking havoc on many persons' lives. And one of the major challenges that we have identified throughout this summit is that not everyone is in a position to afford access to health care. And we know that access to health care is very, very, very expensive. And I think that when it comes to addressing varying health issues globally, we must implement a fund, especially for countries within the global south, really at ensuring that access to health care becomes free. And access to health care should be a universal free language for all, so that person's dependency on the overall healthcare system isn't at economic value, but at ensuring that the necessary resources are provided for persons who are experiencing a wide variety of health issues. So I really believe that globally there needs to be a multi-sectorial approach when it comes to ensuring that each and every individual on planet Earth receives universal free access to healthcare. And I think that is what we should be more focusing on, is ensuring that every person on planet really gets the necessary access they need to adequate healthcare.
So important. Well, one last question before we finish off.
Hi, I'm Trevor Shilton. I'm from Australia. I'm on the World Heart Federation's Advocacy Committee as well. So firstly, I'd extend on my colleague Deanna's comment earlier and say how very pleased we are to have youth engagements in advocacy, and any suggestions you would have for us about how to do that more and how to do that better would be very, very welcome. My question is in relation to global corporations who target children with their unhealthy products. So we heard two examples. Agamroop, clearly the best example, is in tobacco control, and most recently vaping. And we heard from you, Ashley, about unhealthy food promotion in schools, which is very deliberately targeted to children as well. So perhaps if you could make some reflections on how better we can do that. Particularly Agamroop, what are you currently doing in the United States about tackling the tobacco industry and its relentless promotion of e-cigarettes to children?
Yep.
Before you answer, can I just add one comment to exactly
Sure,
the gentleman's point, which is we are standing in the shadows telling Agamroop in our walk back. I don't know how many of you know this. As we walked around the lake, beautiful botanical garden, we walked right past a big, beautiful building, the best architecture building here, which is called Japan Tobacco International. So the irony of this conversation is we are standing in the shadow of a building that is Japan Tobacco. Just want to make the point that these things are pervasive and they're right where you don't expect them.
So the key that I'm focusing on is that these companies are explicitly targeting children. Mm-hmm. So your thoughts on that?
Yeah, well, just like you said, big tobacco never stops. We've noticed that through the way they've evolved their products through the years. We've seen that for the last decades, evolving from cigarettes to now vaping products, and the implementation of flavors. And now they're going even beyond that to create products that taste like the flavors without actually the flavor being there, to bypass some of the policies we put in place. I think there's a multitude of factors that I would say to conquer this. One of the things we've done in California recently is banning the sale of flavored tobacco products. And this is very essential to the work we do, because a lot of youth start, I think it's 96% of youth start vaping because of the prominence of flavors. And so by passing policies that sort of block the products at where they are at and also preventing future innovation by being very inclusive in those policies, that's one of the ways we stop access. And I think that is very needed. But also I think another part, in addition to health literacy and education around these products, is the social media efforts. Big Tobacco is meeting children on the spaces they're at, through the movies they watch, through their marketing on social media, influencers. I mean, it's a fashion trend, I think, throughout the movies. And I think by us actually promoting materials, actually putting out content there that is very health-centric, and health-centric in a way that I think we've talked about in this conference, making health sexy. I think that is something we need to take responsibility of and do. We talk about the media not talking about cardiovascular health. Well, I think that's because we're not talking about it enough, and doing that in ways that youth and other populations will care about. I think that's how we make health a reality for our populations and do it in a way that conquers industry.
That's true. You know, as a journalist with experience in local newscasts, in international newscasts, every time I bring health issues to my producers, they always say, but why should we cover this? Nobody's talking about this. We only cover this. There's like a march, or there's a movement with it. Why are we going to cover it out of the blue one day, explaining to people what happened to people with cardiovascular diseases? So it also comes to show again that we need to start talking about it. Our voices need to be louder so that they can also later get reverberated and reach the policymakers, the people with power. Now, thank you so much. Today we've explored ways that we can use to bring the attention of CVDs to the next level. We've seen methods to bring awareness about the dangers of tobacco, all types of it, and ways to support and educate people already diagnosed with the most common cardiovascular diseases. So how can we push this movement forward in our daily lives? Take advantage of the fact that you're all reputable experts. You all have the power to save a life. Just by talking a few more minutes maybe to explain the CVD risks to patients, a close friend, family members, even a stranger, you can greatly contribute to reducing the burden of cardiovascular diseases. Thank you so much.